Hi, it's Jessica DaMassa, WTF Health, and I'm here right now at the Connected Health Conference, and joining me is a Twitter legend. We have ePatient Dave, and he is a patient activist. So talk to me, tell us your story. How did you become ePatient Dave, Dave de Bronkart?
Twitter legend, that's what I am now, huh?
You are,
okay.
Twitter legend.
Good, that's
how I know you.
That's fine. Well, so I'm an ordinary guy I worked in consumer marketing in technology, and in 2007, I discovered I was almost dead from stage 4 cancer.
Unbelievable.
Obviously, that didn't happen, and it turns out that part of how I managed to survive was I took my doctor's encouragement to get involved, join other patients on the internet, and I ended up learning information that my oncologist didn't have that he says helped save my life.
Wow.
So when doctors today say patients should stay off the internet, I know they're wrong. And so I advocate get as involved as you want to in helping healthcare achieve its potential.
So talk to me about what that means. Because, there's varying degrees of involvement. It's like, okay, I've downloaded this app on my phone, I'm wearing a Fitbit, whatever it is. So for you, what does patient power and patient involvement really mean?
Well, the ePatient name it's involved with Society for Participatory Medicine. There was a doctor named Tom Ferguson who died in 2006, who all the way back in the 1980s was advocating for what he called medical self-care, which he knew depended on information. And when the internet came along, he saw that there were electronic patients. He said they became empowered, engaged, equipped, enabled, all these E's. And it turns out my doctor, Danny Sands, was one of his friends, and he was the one who recommended that I learn about this. And so I started advocating for this. The whole idea is that, as Dr. Sands says in his speeches, we both are professional speakers as a sideline these days, knowledge is power, no kidding, and today we can get at it even if we don't have medical training. And so that could be the app data that we have. It could be just looking stuff up on the internet. Now, people always say, watch out, the internet is full of garbage. Well, I found my wife on Match.com, but she wasn't the first search result that came up,
You gotta comb through those, right?
Exactly. And this was years before Tinder, for heaven's sake. But the point is, yes, there's garbage on the internet, so you gotta be smart and know what you're looking for. And every time I found something, when I was dying, you can believe when I found something on the internet, I asked my oncologist.
Sure.
Right, so this is about partnership.
So, I think I love that. It's about partnership. And you're so famous as far as like patient advocacy is concerned. And it's like anybody who does, read any of the things that you really talk about that are core to your message, it is about, partnership, and it is about working with clinicians. I guess talk to me a little bit about what else, a regular person who is a patient needs to know about becoming an advocate for themselves. You're an advocate for all patients, but to be an advocate for yourself, what else do you need to be?
Well, so this is social change. It's a shift in roles. It's exactly parallel. I was in college in the 60s, so I went through the feminist movement as it swept through Boston. We all had to learn, men and women alike, and now doctors and patients alike, how do we modify this dance? Right. At our participatory medicine conference, we showed a doctor-patient tango, actually had tango dancers on the stage. So everybody has to learn new skills, right, and decide for themselves what they want to get involved in. The ideal role for physicians and nurses, by the way, is to become people who can tell me what apps are good, what websites are worth getting into. It really is. This is a shift to consumerism. Yep. Where in the past, the traditional model was only people with special training could know anything useful. Today that's changed, and it requires that we shift from being passive receivers of stuff and advice to making our own decisions about what's important to us and learning how to go find it.
Do you think that patients at this point, with the way the health system is right now, obviously you have access to the internet, but I'm talking about like the data that's in the health systems. Are we equipped to make those decisions and to really look at what we have available to us?
Well, I think the real question is not, are we equipped? The real question is the data is whether the data is worth getting at. I mean, the easiest way for somebody to start becoming a consumerist patient activist is to go get all their data in different doctors and hospitals' offices.
That's a momentous task at this point.
Well, it is, even though they're legally required to give it to us without difficulty. And the thing you want to do is check for mistakes. One of my chest x-rays identified me as a 53-year-old woman.
Wow.
One of my mother's charts had her thyroid condition backwards so that the best doctor in the world would have given her the opposite medicine.
Wow.
And done harm. So it's an easy way to get started. Now, it's funny, consumerism is a subject where people's heads are just pointed in 19 different directions. Sure. The Wikipedia article has 6 different definitions, ranging from the tool of the machine, the mindless consumer of whatever the capitalist system shoves down their throats, to a fully activated thinking person who says, wait a minute, I know what I want. I don't want what you're selling.
So where do you sit on that spectrum here? How do you define consumerism in healthcare?
Well, to me, consumerism, I'm always sensitive to the fact that different people will hear different things. Okay. My working definition is that anybody who cares how things are going to turn out, whether it's medicine or buying a TV or a car or anything, had better get involved in learning what they can. Right. I'm no automotive engineer, I'm no TV engineer, but I read what I can. And most importantly, I set my priorities. For me, fuel economy is important. So I have a 12-year-old Prius that's still getting 48 miles per gallon. You know, I could have a Tesla, it would be cool, but
it's not what's important to you. And so it really is, I guess, like what it sounds like is just really not only, aggregating and kind of controlling your experience as a patient, sure, but also finding out what's important to you and what's of value.
Well, and a really essential change is happening in healthcare, which has to do with patient access to data. A lot of people have said, this stuff is complicated. What use would patients have for it? But I'll tell you, that shifts radically when it's you or a family member, sure, whose life is on the line. And interestingly, the great majority of impressive stories about this are mothers taking care of their kids. I just yesterday heard 2 different talks from Angela Kennedy and her daughter Grace. Sure. And Christina Sheridan and her daughter Kate, extraordinary stories of where they pulled together on their own enormous amounts of data and helped transform things. There's another book called The Other Side of Impossible, where Susanna Meadows, a former New York Times writer, writes about how she cured her son's horrible digestive problems, improbable, and 6 other stories. And all of this has to do with access to information. My biggest explosively optimistic sign of what's arriving, I love to talk about the arriving future of healthcare.
Yes, tell us.
Is that, well, the FHIR, F-H-I-R, software interface is making it possible now. My Twitter avatar says, I want a health data spigot, and it has a picture of a big faucet. Whatever the FHIR software developers are doing to move data between medical systems, doctors' offices, and so on, I want them to just put a spigot off to the side so I can just get a copy. Because we're already seeing the early signs of people who have programming skills today creating their own personal apps that only they will use, and it's working.
Okay. I mean, that's incredible. I mean, to have to go through the trouble, though, of creating your own personal app just to have access to an aggregated record.
But if you study the history of innovation, yep, Jeffrey Moore's stuff, there's always the early adopters, sure, are the people who will take 85% of a solution and add the remaining 15%. But then, when that spigot lets all the data become this giant pond, we will see developers jump in, yep, and create things that the rest of us can use. And this is exactly what happened years ago in my industry, the graphic arts. This thing called desktop publishing came along, right? And all of a sudden, the typesetting machines and print shops and everything no longer controlled things. I worked in that industry, and we said, you people don't know what you're doing. You don't understand picas and points. You can't handle a Helvetica, you know? Well, so what happened was you use fonts today,
Yeah.
right?
I got your font joke.
My daughter uses fonts. Everybody uses fonts, and everybody looks back and says, "What was the big deal?" Well,
right.
that's what's coming for patient access to health data.
How far away do you think we are from that, Dave?
It's impossible to tell.
Yeah.
It's impossible to tell because desktop publishing actually collapsed the typesetting industry in about 5 years.
Well, people are looking at the whole Amazon, Berkshire Hathaway, J.P. Morgan, and even the CVS Aetna as kind of like a harbinger of the collapse of the way the health system is now. And a lot of that has to do with the conversation around data. What are your thoughts on that?
Well, I think it's far more likely that we're going to see like a forest of mushrooms pop up with people solving things for themselves. But what people don't comprehend is that the healthcare industry in the U.S. is massively bigger than the graphic arts industry was. It's going to take a lot before that thing collapses. But I think something I don't think people focus enough on is that from what I've heard, both Apple and the Amazon crew and some other companies didn't go at it as we think we can take a piece of this market. They approached it as what can I, Apple, do to improve health costs and health care for my employees.
Right.
And then they realized this system is optimized for something other than getting the job done.
What do you think it's optimized for?
Well, it's very obvious. I wrote a blog post that people could look up. The title is American Healthcare is a Malignant Tumor That Can't Stop Killing Its Host. And after years of studying and speaking at hundreds of conferences around the world, what I came to realize is that what's distinctive about the U.S. health system is that it is a galaxy of individual boards of directors. Each of which, and I'm not talking, some people think this is just malice and evil cigar chomping mean guys saying, kill those people and take their money. It's not, I'm talking about, there are so many insane stories we hear that all boil down to one party or another saying, I know it would make sense to do that, but our board of directors needs to keep the money. And I have crazy stories of things that I've personally experienced. And this is why it's just until you change away from the capitalist model, and I'm a capitalist, I like to make money and all that, but it's the problem is with all those boards having those concerns, there is nobody who has buck stops here responsibility for making sure the job gets done. So there is nobody who steps in when somebody experiences a medical bankruptcy. Right. You know, and some board somewhere is saying, I'm sorry, but we need your money.
Yeah, I mean.
Well, and this is why I'm not predicting the collapse of the system, but I am predicting a whole bunch of people developing apps or buying apps, acquiring apps in the coming years that help them solve their own problem.
Is the patient having access to their data really the linchpin in all of this for you?
How else can you, imagine being told you can drive a car now, but we're going to cover your windshield so you can't see what's happening. You know, knowledge is power. You can't possibly control or keep an eye on things. You know, I'm known for surviving a nearly fatal cancer, but a few years after that, my doctor told me I was pre-diabetic. You know, and so I thought, I know what I'll do. I went out and I bought myself a wristband. I'm going to get one of these gadgets. But over the holidays, my weight went up.
And so you
right? Well, no. I realized the issue was behavior change.
Yeah.
And so I got into the YMCA's diabetes prevention program, and in the next year, I lost 30 pounds using that behavior change program, but supplemented by a diet tracking app, right, and step counting and so on, so that I could see what I was doing as I went along. Mm-hmm. And amazingly, I'd always said, I'm not going to be a runner. Running hurts. Pound. But after a year of just going for walks, which is how I lost that weight, my feet started saying, oh, come on, let's trot. And I lost another 10 pounds, and now I do 5Ks. So for all the people who say old people aren't going to change their behavior, I got news for you. I ran a mile for the first time in my life at age 65.
That's amazing.
Supplemented. Well, and you know, in my TED Talk, two things in my TED Talk. First of all, I had a rap give me my damn data.
Which I love. You've got to look that up.
But the end at the end was a chant. This is not about patients saying who needs doctors. The chant was, let patients help. Let patients help. And they can't do that. We can't do that if we don't have access to the data.
Dave, it is amazing to speak with you live and in
thank
person.
you.
I follow you on Twitter, and you've got to check out that rap if you haven't seen it, those out there watching.
I want to be an e-patient just like Dave.
I love it. I love it. There should be a mic drop after that. I love it. Dave, thank you so much for joining us. It's such a pleasure to meet you in real life and to speak with you. Thank you so much. I'm Jessica DaMassa with WTF Health. Thank you.
You certainly are.